and welcome to Connections for Change. I'm Ebony Bowden, the New York Post's Washington correspondent. It gives me great pleasure to introduce Dr. Ian Meredith. Dr. Meredith is the Chief Medical Officer and Executive Vice President at Boston Scientific, based in Boston. Previously, he was the Professor of Cardiology at Monash University, the Director of Monash Heart and Monash Health, as well as the Executive Director of Monash Cardiovascular Research Centre. In 2012, he was appointed as a member of the Order of Australia for his work as a clinician and a researcher in cardiology, as well as his contributions as an advocate and advisor to public health organisations. We're very grateful to have Dr. Meredith here today to respond to questions from the Monash alumni community on global health and innovation in medicine. Dr. Meredith, thank you for joining us today.
Ebony, thank you for having me.
So why don't we start by you telling us about the work that you've been doing on COVID-19. You've been looking at this very closely since mid-January. What specifically have you been researching and looking at?
Well, interestingly, if you'd asked me at the end of 2019, would I have any role to play in epidemiology or infectious diseases sciences, I would have said, of course not. I'm an interventional cardiologist, and I joined Boston Scientific as an advisor on medical technology and how it'll play a role in chronic non-communicable diseases management in the 21st century. Of course, as we know, what happened early in 2019, early 2020, is we started to see signs of the COVID breakout in Wuhan province in China. And I took a great interest in this just simply because even at the earliest signs, it seemed to be a highly transmissible illness, a lower respiratory tract illness, and it was also a zoonotic infection, in other words, starting in animals and spreading to humans. And by and large, recent forays in that field, or recent zoonotic type infections, have been quite severe: Zika, Ebola, and the original SARS. So from the company perspective, we're 35,000 employees strong, and we're in 130 countries and very significant footprint in China. I couldn't help, as a chief medical officer, not to take an interest in what looked like to be an emerging epidemic, not realising it was going to go on to a pandemic status, but it had all the hallmarks of something that we should take notice of. So that's how I got started in this.
Mm. And what have you, in your role as the Chief Medical Officer at Boston Scientific, have you been doing research on this? Have you been part of the effort to gather supplies for the US fight against the virus? What have you been, has this consumed your work over the last few months?
Yes, it's totally consumed my work over the last 3 months, because having 35,000 employees in all those countries and trying to help direct not only the regional presidents but the company as a whole as to how we should be managing this, with the staff that are moving across the world and going in and out of healthcare facilities, plus understanding how it would impact on our product, because we have medical products that are being used in a variety of emergency, semi-emergent and elective procedures. So I formed a group, essentially, of some of the best clinicians we have within the organisation, and indeed a wide range of health scientists, and from molecular biology to genetics experts together to come to form a team within BSC, so that we could study various streams of what was happening with the illness, so we could best inform the company with respect to the health and safety of our employees, the travel policies, those sort of things in the first instance. But then, as you said, it grew into far more in terms of personal protective equipment, preparedness, and aiding in the distribution of those for centres in need, and also turning our attention to what things that we could actually produce to help the fight against COVID.
The international community and the medical community is so focused on fighting the virus now and getting it under control and flattening the curve. I'm wondering what you think some of the key areas that the medical community should be looking at and considering beyond this immediate crisis that we're in now?
Well, great question. So I think flattening the curve is absolutely critical. It's very important, and we're thankful to all of those who've studied epidemiology in the past and taught us the history of pandemics and epidemics to understand that those non-pharmacological measures, social distancing and all of those behavioural changes were going to help prevent the transmission of what was a highly transmissible illness. And so beyond those activities that we've taken, where to next is obviously preventing second or recurrent waves of this illness, but yet at the same time planning to return to work and resume normal clinical procedures, but do it in a safe and effective way. So we're spending a lot of our time now on the roadmap to the future in terms of how do we go back as a medical device company providing medical devices in the acute healthcare setting where patients are reluctant to return anyway, and yet procedures still need to be done. You can see deaths at home from untreated cardiovascular disease have gone up 4 to 6-fold in many of the major cities around the world. So in order to meet that challenge, we have to plan thoughtfully and safely to actually be able to balance the risk of exacerbating second or tertiary waves of this illness, or beyond that even, and at the same time making thoughtful recovery of medical processes for people in need.
That's really interesting. I mean, certainly a lot of people aren't going to hospitals right now and getting the elective treatments that they need. Can you perhaps talk about some of the innovations that you think have come out in response to coronavirus, both from a medical supply standpoint and just things that you've seen in the medical community that have been really interesting to you in the last few months?
Perhaps the number one thing that we've seen accelerated in this era has been the telehealth solutions. They've always been there, and it's always been an option. But I think we've seen a rapid acceleration and uptake of telehealth solutions, much like you and I have now, to aid in the consultation, the diagnosis and the post-acute care of patients, to keep them out of the major healthcare facilities. And along with that, there's been enormous acceleration in online digital medical education and training. For argument's sake, if you need to learn a procedure, instead of me coming to you as a proctor to show you how to do that procedure, now we're doing remote telementoring and remote teleproctoring so that we could watch you do the procedure and talk to you and aid you in the process of doing a procedure that you might not have learned as part of your normal medical training or prior to graduation. So I think the biggest acceleration is really in that whole digital sphere, whether it be from patient consultation right through to education and training of physicians. And that's the area that we're seeing accelerated now at almost exponential rates. It's always there. We always knew about it, but I think COVID has actually really ignited the need for that.
Yeah. You spoke earlier, Dr. Meredith, about being in charge or responsible for tens of thousands of employees. And I wanted to ask you what some of the key learnings you've taken away from this in terms of leadership in crisis. How have you been challenged and what have you learned and what has worked for you?
Well, I think of the things that I've learned is open, honest, transparent, authentic, frequent communication. Say what it is that you don't know. Explain the limitations of the things that you do know. And since the data is emerging very quickly, I keep using the analogy of a building being built. It's hard to understand what the building is fully going to look like, even from the architect's plans, until it's built. And we are in the process of building that building, and we're learning as we're going. And so I think you surround yourself with the right people, with the right knowledge, trust them to inform you and advise you wisely, and then communicate openly, transparently, and point out the limitations. And I think that's been the underpinning of the way I've approached the clinical leadership in this organisation. The truth is the truth, and there are limitations to the tests that we have today, and people are intelligent and they can deal with understanding what those limitations are. And so I think transparency, objectivity and honesty are the key messages.
That's refreshing and nice to hear. Final question from one of our Monash alumni. Dr. Meredith, in what ways do you think this crisis has made you rethink the way we solve healthcare's toughest problems, not only in the US where so many people are uninsured, but just globally?
Oh, it's a big question, but a good one, Ebony. So the first thing I would say is that we really didn't have preparedness for a pandemic. Now, and in every century for the last 5 centuries, there's been some pandemic illness. We perhaps didn't learn enough from the AIDS pandemic. We have had epidemics like SARS-CoV-1 that didn't make it to the pandemic status. So I think the number one thing that will change healthcare going forward is the preparedness that this could happen in the future. Now, why would I say that? And I don't say that to be a doomsday person, but there is an increased density of people on the planet. The population on the planet is growing. The population on the planet is ageing. We are far more mobile than we have ever been previously. So the ease with which illness can spread across the globe is going to be exacerbated. So I think the number one thing that going forward is the preparedness for this happening again, and changing health practices such as we see with telehealth and digital health solutions that might mean that health is conducted and people are cared for in slightly different ways to the way that they had been traditionally in the 20th century. That doesn't mean we don't that we would take away the most critical element of healthcare, that is care, that is compassion, understanding, empathy. That will always prevail through healthcare, but the mode by which we do many simple things, I think, will change, whether it is smart wearable devices, information that uploads about you, that are connected devices that give us more understanding of population health, right down to the sort of consultation that we're having now, or the interaction that we're having now. Our company is already doing 15,000 Microsoft Teams meetings a day.
Wow.
Already 15,000 Microsoft Teams meeting a day. Now, previously, somebody would fly somewhere, they would gather, fly home. So I think we'll see a lot less travel and a lot more of this interaction, but none of this replaces the most important aspect of healthcare, and that's the humanity of care.
I think that's a fitting way for us to close our Connections for Change interview. Dr. Meredith, thank you. We're so grateful for your insight. Thank you for giving us perspective. And thank you to our Monash alumni for their insightful questions.
Thank you, Ebony. It's a pleasure to join you. And I hope at some stage I get to see you face to face, maybe share a beer.